If you or someone you care about struggles with constipation, this video is for you. I am Dr. Jean-Pierre Kabongo, family physician and health advocate, founder of the HOMESTEADication movement. Constipation is very common, yet it is often misunderstood. Many people think of constipation as a simple bowel problem, but in reality, it is often a signal that the digestive system is under stress or out of balance. Today I want to explain what constipation really is, why it happens, and how the HOMESTEADication approach can help restore regular, comfortable digestion. Let's begin. Constipation is usually defined as infrequent bowel movements, hard stools, difficulty passing stool, or a feeling of incomplete emptying. But constipation is not a disease on its own. It is a symptom. It tells us that something is interfering with the normal rhythm of the gut. In most cases, constipation develops gradually. It may begin with travel, stress, diet changes, medications, or a sedentary lifestyle. Over time, the bowel becomes slower, less responsive, and more difficult to empty. Here is an important concept. The digestive system is not just plumbing. It is a living, moving system that responds to food, hydration, movement, sleep, stress, and environment. If those inputs are disrupted, bowel function often slows down. This means that for many people, constipation can improve and sometimes fully resolve when the underlying causes are addressed. This is where HOMESTEADication comes in. HOMESTEADication focuses on 5 core pillars: nutrition, movement, hydration and rhythm, sleep and stress, and environment. Let's go through each one. First, nutrition. One of the most common contributors to constipation is a low-fiber, ultra-processed diet. Fiber adds bulk to stool and helps stimulate bowel movement. Whole plant foods naturally provide fiber. This includes vegetables, fruits, legumes, nuts, seeds, and whole grains when tolerated. Highly processed foods, on the other hand, often lack fiber and slow digestion. For many people, gently increasing fiber intake. Aim for 25-30 Hg of fiber a day helps stools become softer and easier to pass. This should be done gradually to avoid bloating or discomfort. Constipation is rarely solved by a single food. It improves when the overall diet supports gut movement. Following fruits, grains, seeds are very helpful. Chia seeds, ground flaxseed, psyllium husk, oat, prunes, papaya, legumes such as lentils, chickpeas, black beans. However, following food can complicate and worsen constipation. They should be avoided or limited. Bananas, especially unripened. Fresh cruciferous like cabbage, broccoli. Hydration plays a major role. Fiber works only if hydration is adequate. The colon absorbs water. When hydration is inadequate, stool becomes dry and hard. Drinking enough fluids throughout the day helps keep stool soft. Just as important as hydration. I have a fully dedicated video on water consumption that I would link at the end of this video. You can watch it for more details on the best way to stay hydrated. Supplementation with magnesium helps release constipation. 200 to 500 milligrams magnesium citrate taken with a glass of water usually helps. If so far you find this video helpful to you, please subscribe and hit the notification bell so you don't miss similar video like this one in the future. Second, movement. The bowel responds to physical movement. Walking in particular stimulates the natural contractions of the intestines. When people become sedentary, bowel activity often slows. Daily walking, gentle stretching, and regular physical activity can significantly improve constipation. Movement does not need to be intense. Consistency matters more than intensity. Even short walks after meals can make a difference. Third, established regular routine. The gut functions best with regular daily rhythms. Ignoring the urge to have a bowel movement, rushing in the morning, or irregular schedules can train the bowel to slow down. Allowing time each day, especially after meals, helps retrain normal bowel reflexes. Constipation often improves when the body knows there is time and safety to eliminate. Fourth, sleep and stress. The gut is deeply connected to the nervous system. Stress activates the body's fight or flight response. In this state, digestion slows. Chronic stress, anxiety, and poor sleep are common contributors to constipation. Improving sleep quality, slowing down meals, and practicing relaxation techniques can restore normal gut signaling. The bowel works best when the nervous system feels calm. Fifth, environment. Our environment shapes digestion more than we realize. Rushed mornings, constant screen time, irregular meals, low daylight exposure. All of these disrupt the natural digestive rhythm. Small environmental changes help. Eating meals at regular times, sitting down to eat, reducing distractions, getting daylight exposure in the morning, having routine for bowel movement. These signals help synchronize the gut with the rest of the body. So what does improvement look like in real life? For many people, bowel movements become more regular. Stools become softer. Straining decreases. Abdominal discomfort improves. Some people are able to reduce or stop laxatives, always with appropriate medical guidance. This process takes patience, but it is far more achievable than many people are told. Constipation does not mean your body is broken. It often means your digestive system is responding to stress, disruption, or imbalance. HOMESTEADication is not about forcing the bowel. It is about restoring the conditions that allow digestion to work naturally. When the environment improves, the gut often follows. If you have tried the above and things still don't work, you may need to consult your doctor, as the constipation might be just a symptom of underlying medical conditions such as hypothyroidism, hypercalcemia. Certain medications as well can cause constipation. Opioids, anticholinergics, antidepressants, TCAs over SSRIs, antipsychotics, calcium channel blockers, iron supplements. Calcium supplements, usually benign, constipation can be an indication of a serious condition. Therefore, a prompt consultation with your doctor is warranted. If you have following symptoms, red flags: unintentional weight loss, rectal bleeding, anemia, new onset constipation after age 50, severe abdominal pain, family history of colorectal cancer, laxatives can be helpful when used appropriately, but misuse or prolonged use may cause important side effects. Common adverse effects include abdominal cramping, bloating, diarrhea, dehydration, and electrolyte imbalances, particularly low potassium. Regular use of stimulant laxatives can lead to dependence, reduced bowel responsiveness, and worsening constipation when stopped. While osmotic laxatives may cause fluid and mineral disturbances, especially in older adults or those with kidney disease. To use laxatives correctly, lifestyle measures such as adequate fiber intake, hydration, and physical activity should always come first. Laxatives should be used at the lowest effective dose for the shortest possible duration and chosen according to the type of constipation. Before I let you go, let me tell you about Cynthia. Cynthia is a 41-year-old woman. She came to see me as a new patient after her family doctor retired. She had been struggling with chronic constipation for years. She was having only 2 to 3 hard bowel movements per week. She also described severe pain when going to the bathroom with blood in her stools. Her symptoms were consistent with a chronic anal fissure. Each hard stool reopened the wound, preventing it from healing. Because of the pain, she developed a fear of going to the bathroom. This led her to delay bowel movements, making her constipation worse. She told me she could not go to the washroom without laxatives. She was taking Metamucil up to 5 times a day without improvement. In addition to constipation, she complained of bloating, fatigue, and frequent headaches. When she came to see me, her usual laxatives were no longer working. I explained what was happening in her body. We reviewed her diet and found it was low in natural fiber. I advised her to increase fiber from whole foods. Specifically, I recommended 1 tablespoon of chia seeds and 1 tablespoon of ground flaxseed, mixed in water or milk twice a day. I also asked her to increase her water intake to 2 to 3 liters per day. As a short-term solution, I prescribed lactulose to soften her stools. I also prescribed a topical cream to apply to the anus twice daily, and after each bowel movement to help the fissure heal. I advised her to take as well 200 milligrams magnesium oxide twice a day. Because of her rectal bleeding, I referred her to a gastroenterologist for evaluation. 1 month later, during a follow-up phone call, she reported major improvement. She was having 2 bowel movements per day. Her stools were softer and much less painful. The bleeding had stopped within 2 weeks. 3 months later, she contacted me again. She still had no bleeding, no pain, no straining. She told me she had never felt so well in her life. Her bloating had resolved. Her headaches had improved. Her mood was better. Her energy was higher. Her mental clarity had returned. She had lost 5 pounds, and her abdomen was noticeably flatter. This is a classic case of chronic constipation, complicated by a chronic anal fissure and resistance to laxatives. By addressing the root cause, poor diet and inadequate fiber, her symptoms resolved completely. As you can see, constipation is not only about a problem. It's going to affect the entire well-being, including your mental health. Please tell me your preferred method of dealing with constipation. And if you know someone struggling with constipation, please send them this video. It will help improve quality of life and even save life. Thank you for watching.